And then when patients ask me, we've got a family history of ET, and we also have a family history of Parkinson's. So does essential tremor lead to Parkinson's in some individuals? And the answer is yes. So it looks like if you have a family history of essential tremor, or if you have essential tremor, you are at higher risk for developing Parkinson's or dystonia down the road. So we call that Parkinson's disease with antecedent ET. And this is most commonly noted in patients with long-standing history of essential tremors. They have decades and decades of tremor, maybe sometimes as early as their teenage years or childhood years. And I see them when they're in their 60s and 70s. They've been diagnosed as ET all this time. And then I appreciate some Parkinsonism, and I kind of say, okay, you now have a double whammy, which is Parkinson's with ET. And then rarely, if Parkinson's is the initial diagnosis, can you develop essential tremor? And the answer is also yes. So you can have two conditions in your brain, both Parkinson's and ET. And the good thing is that patients with ET and Parkinson's actually don't have a worse prognosis in comparison to just PD alone or ET alone. So here's an example of a patient with a rest tremor in one hand, has a long-standing history of essential tremor. And the question in my mind is this chronic essential tremor with some subtle Parkinsonism, which in this case is a rest tremor, or has the patient now developed Parkinson's disease? So it may be confusing when we see patients like this. And mind you, the rate of misdiagnosis of early Parkinson's, or should I say suspected early Parkinson's, among experts like myself, according to a pathology study, can be as much as 42%, which is quite whopping. It's most confusing in patients like this one, where again, they start off with years and years and decades of essential tremor, and then develop some Parkinsonism along the way. So how do we differentiate essential tremor versus essential tremor with Parkinson's? So a lot of you in the audience know what a DAT scan is, or a dopamine scan is, and probably have undergone this particular scan. So this is not a CAT scan. It's not an MRI. It doesn't look at these structures in the brain. All it looks at would be the dopamine signal or uptake in the so-called basal ganglia or striatum. So this is a normal DAT scan. I kind of say it's tadpole shape. You got the head of the tadpole there and the tail over here. And the head is called the caudate, and then the tail is called the putamen. So this is normal. You get to see this crescent shape or bean-shaped structures, which is bilateral. And then if you look at the Parkinson's brain, the DAT scan in a Parkinson's individual, you see loss of the putamenal signal, which is the first thing that we see in patients who are developing Parkinson's disease. And then sometimes the DAT scan is read as being borderline or just showing age-related conditions, and yet have a patient that's really florid and obviously Parkinsonian. And so the question in my mind is the DAT scan really normal, or is it mildly abnormal? And that's where the skin biopsy comes in. So the skin biopsy for alpha-synuclein came about maybe commercially at least a little over 2 years ago. So what do we look for in the skin biopsy? So we look for a protein called alpha-synuclein. So alpha-synuclein is a normal protein in many of your cells, particularly in the brain. Although when it aggregates and clumps together, it forms a pathological body called the Lewy body, which is made up of clumped up or aggregated alpha-synuclein. So we do a simple skin test. We do a punch biopsy, and then the pathologist will use a stain called PGP 9.5, which stands for nerve axons. So whatever we see green here are the axons of the nerves from the biopsy. And then next, the pathologist will stain it for alpha-synuclein. And the alpha-synuclein appears red. So if you see, you now compare what is green, which is where the neurons are, or should I say the nerves, peripheral nerves, with this, which is the second image, which stands for alpha-synuclein. And you will see that there is robust, alpha-synuclein in the same neurons, or should I say nerves, that were demonstrated in the previous stain. So this is how we confirm whether you truly have Parkinson's or not. However, it's not specific for Parkinson's disease. So if you have Parkinsonism, and it's clinically evident. This rules in 3 conditions. So Parkinson's disease, which is the most common thing. And the second most common thing is a multiple system atrophy, or MSA, which is probably the most common misdiagnosis, or should I say the closest mimic to Parkinson's out there. And then the third condition is dementia with Lewy bodies, which presents primarily with dementia, hallucinations, and some Parkinsonism. So if you have essential tremor, and then you now develop some non-motor symptoms, which of these non-motor symptoms is predictive of possible Parkinson's, or that you are on the road towards developing Parkinson's down the road? Okay, so there's a few ones here that are very important and are associated, highly associated with premotor Parkinson's or motor stage Parkinson's, which are, number 1, REM behavior disorder or dream acting. So at night, they thrash around, they kick, they punch, they yell, they have nightmares, they sleepwalk. And the second one is impaired sense of smell. Although I usually query, whether patients are smokers or have sinus conditions or a broken nose, they can impair their sense of smell, or they just had COVID, which is, something that we start asking about. And then in the office, we can actually test for this. There's a smell kit called the UPSIT. So we make you scratch and sniff. There's a scratch and sniff test for this. And we make you scratch and sniff 40 items. And then there's normal scores that we look at, and abnormal scores, obviously. And in Parkinson's, this sense of smell is very impaired even before the diagnosis is made. In fact, this can start as early as 15 to 20 years before the first, motor symptom like tremor or rigidness or slowness, appears. And then there's constipation, there's visual hallucinations, and impulse control disorder. So this refers to compulsions like gambling, hypersexuality, binge eating, and compulsive shopping.